Good morning, everyone. I am Elaine Ferraro, and today we are going to discuss the postpartum complications in NCM 109. Postpartum hemorrhage. It is defined as the loss of more than 500 ml of blood after vaginal delivery and 1000 ml of blood after cesarean section. Although some blood is expected during childbirth, postpartum hemorrhage represents a pathological loss that can rapidly lead to hypovolemic shock, organ failure, and even death if not treated immediately. So we have the early or the primary postpartum hemorrhage. It occurs within 24 hours after birth, and late or the secondary postpartum hemorrhage. It occurs 24 hours to 6 weeks after birth. So we have the causes of postpartum hemorrhage, the 40s. Number one is the tone or the uterine atony. It is the most common cause. Number two is the tissue from retained placenta, trauma from lacerations, uterine rupture, and the thrombin from coagulopathies. So the signs and symptoms of postpartum hemorrhage. Number one is the excessive bright red bleeding, soaking more than 1 pad per hour, the boggy uterus that it is the uterus that unusually soft during physical examination, tachycardia and hypotension, cold extremities and dizziness, and decreased urine output. Nursing assessment for postpartum hemorrhage. Frequent fundal and bladder checks. The vital signs are need to be monitored every 15 minutes, and also the pad count. Weigh pads for accuracy. Evaluate for shock, skin turgor, and mucous membranes, and also observe for transfusion reactions if applicable. Nursing diagnosis. Deficient fluid volume due to massive blood loss, risk for ineffective peripheral tissue perfusion from hypovolemia, and risk for bleeding due to poor postpartum education or delayed recognition. The treatments. NPO in case of surgery. If the patient is experiencing shock, elevate the legs in 30 degrees and supplement oxygen. Use 14 to 16 or 18 gauge needle for IV access. Replace with crystalloid fluid replacement, the NS, dextrose, and LR. Transfuse PAC RBC, the RBC, WBC, and plasma. Increase oxygen carrying capacity and blood volume. Transfuse fresh frozen plasma or the FFP that contains all clotting factors. Transfuse cryoprecipitate, transfuse platelets to control and prevent blood loss, and do pericare and frequent pad changes. The goals are to detect signs of hemorrhaging quickly, stop the hemorrhage, correct hypovolemia, treat underlying cause, and lessen the blood loss. So the next one is the uterine atony. Uterine atony is the lack of effective uterine muscle contraction following delivery of the placenta. Uterine atony or the uterine tone refers to a soft and weak uterus after childbirth. It happens when your uterine muscles don't contract enough to clump the placental blood vessels shut after childbirth. This can lead to life-threatening blood loss after delivery. So here are the risk factors. Overdistension of uterus. For example, if the patient carried a twins, large baby, or a polyhydramnios baby. Number two is the prolonged or precipitous labor, oxytocin augmentation, or high doses of oxytocin, preeclampsia, anesthesia, and obesity. So the assessment. Palpation of fundus. Check if the uterus is soft or boggy or if it is a firm. Vital signs monitoring. Check for bleeding amount and character of lochia, and also the bladder assessment. The initial interventions are fundal massage, immediate manual stimulation, empty the bladder, start IV fluids, and notify the physician immediately. These steps aim to restore the uterine tone quickly. A firm fundus is the goal. If the interventions are delayed, it could lead to hypovolemic shock or maternal death. Nursing care and monitoring. So monitor vital signs and bleeding. Perform fundal massage every 15 minutes. Administer medications as ordered. Maintain accurate intake and output. Provide emotional support and prepare for potential emergency procedures.
So the laceration of genital tract, laceration of the perineum vagina or cervix. This is a bright red bleeding persists in presence of firmly contracted uterus. The reason why we have a laceration of the genital is nulliparity, epidural anesthesia, presitus, childbirth, macrosomia, percept or vacuum, or oxytocin. So the treatment, early repair with suture, clean the area with warm water and a mild unscented soap. So next, take a pain reliever and apply ice pack. So next, the retained placenta fragment. Diagnose retained placenta, that is partial separation of the placenta during massage of the fundus before spontaneous placental separation. Assess the intactness of the placental after expulsion. So next, the hematomas. This is an injury caused to blood vessels of vulva, vagina or pelvis, episiotomy, forceps or volume birth, macrosomia, preeclampsia, prolonged secondary stage. Assess sign of hematoma. First, the edema, cytomosis, tenderness of tissue overlying hematoma, mass bulging, and tenderness of palpation. And next, the treatment, less than 3 cm in size, ice pack analgesia, heat applied after 24 hours, facilitate reabsorption of blood within hematoma. Cisbat, aid fluid absorption, promote comfort after first 12 hours. Analgesic, large hematoma, surgical repair, incision, drainage, blood vessel ligated, wound closed with or without vaginal packing, temporary indwelling, catheter if necessary, and antibiotic. Uterine inversion, prolapse of the uterine fundus to or through the cervix, turned upside down after birth, abnormal adherence of placenta, weakness of uterine muscles, rapid labor, uterine relaxation, excessive traction on umbilical cord, vigorous manual removal of placenta. So next, the treatment, immediate repositioning, analgesia. So next, the coagulation disorder. Postpartum bleeding persists with no identifiable cause. DIC, preeclampsia, amniotic fluid embolism, prolonged intrauterine fetal demise, and disorder syndrome. So next, treatment, monitor lab values, replace floating factors, refuse with packed RBCs, may need uterine artery embolization or hysterectomy. So next, the subinvolution, pelvic US, confirm return placenta, routine exam 4 to 6 weeks after birth by manual palpation and large softer than normal uterus. Assess for subinvolution and failure to return to normal size of the placental site or retention of placental tissue. Fundal height is greater than expected. Local ubra persists for longer than 2 weeks. So the treatment, methylgonopinmate or metergine or antibiotics.
Endometritis. Endometritis is an inflammation or irritation of the lining of the uterus, the endometrium. It is not the same as endometriosis. Causes of endometritis is caused by an infection in the uterus. It can be due to chlamydia, gonorrhea, tuberculosis, or a mix of normal vaginal bacteria. It is more likely to occur after miscarriage or childbirth. It is also more common after a long labor or C-section. The risk of endometritis is higher after having a pelvic procedure that is done through the cervix. Such procedures include the DNC, endometrial biopsy, hyperoscopy, and placement of an intrauterine device or the IUD. Endometritis can occur at the same time as a Symptoms of endometritis: abdominal distension, abnormal vaginal bleeding, abnormal vaginal discharge, which is increased amount, unusual color, consistency, or odor. Discomfort with bowel movement, including constipation. Fever ranges from 37.8 to 40 degrees Celsius. General discomfort, uneasiness or ill feeling or malaise. Plan in lower abdomen or pelvic region or the uterine pain. Exams and tests for endometritis. The healthcare provider will perform a physical exam with a pelvic exam. The uterus and cervix may be tender and the bowel sound may be decreased. Patient may have cervical discharge. The following tests may be performed: cultures from the cervix for chlamydia, gonorrhea, and other organisms. Endometrial biopsy, ESR or the sedimentation rate, laparoscopy or the WBC or the white blood count. Treatment for endometritis is treatment with antibiotics is important to treat the infection and prevent complications. Complicated cases to those occurring after childbirth or involving severe symptoms may require the patient to be admitted to hospital. Intravenous antibiotics are usually needed, followed by antibiotics taken by mouth. Rest and hydration are important. Treatment for sexual partners and appropriate use of condoms throughout the course of treatment are essential. So, ang possible complications niya is infertility, pelvic peritonitis, generalized pelvic infection, pelvic or uterine abscess formation, septicemia, or septic sac. So, to prevent endometritis caused by sexual transmitted infections can be prevented by early diagnosis and complete treatment of sexual transmitted infections, STS, in the patients and all sexual partners. Following safer sex practices, just as using condoms, the risk of endometritis is reduced by careful sterile technique used by appropriate providers in performing deliveries, abortions, IUD placement, and other gynecological procedures.
So, hello everyone. I am Diana Angelica B. Guzman. We'll be discussing the postpartum complications about the thromboembolic disease. First, we have the deep vein thrombosis. Here in deep vein thrombosis or DVT, it is different in thrombophlebitis because thrombophlebitis, it is a causes of deep vein thrombosis. Now, to diagnose this, we have to use the diagnostic exam like the venous ultrasound to check the prothrombin time and the thromboplastin time. And we have the clinical manifestations like virtuous triad, venous stasis, hypercoagulability, and injury to epithelium. And then we have the blood clot formed in response to inflammation of the vein. That is the definitions of the deep vein thrombosis. And here in deep vein thrombosis, it treats with the pregnant woman who having the polyhydramnios because in increasing amniotic fluid, in amniotic fluid volume, it can cause what we call amniotic fluid embolism. Next, we have the preeclampsia. In preeclampsia, we have because of the high blood pressure, it develops our DIC and also a trauma. For the treatment, we have the anticoagulants such as the heparin and warfarin. We have to put the patients into a bed rest. We have to put the patient also in elevation of leg, and we have to also instruct the patient to wear the compression stocking. Now, next, in a pulmonary embolism, here, to diagnose this, we have to use the imaging test. This is the pulmonary embolism. It is a thrombus from lower extremity lodges in pulmonary vascular bed. It is restricts circulations because here in thrombus, ang pagkakaiba nun is when the thrombus it plays in one place, it stay in one place, while the embolus it is the very delikado kasi It can dislodge in another place, and also kapag pumunta yan sa pulmonary natin, pwede siyang magkaroon ng pulmonary embolism, and it's very dangerous because that is a traveler clot, yun yung tawag. Then because of the nasa pulmonary vascular bed na siya, it can dislodge in the cardiopulmonary and impede the gas exchange in the alveoli. That's why the clinical manifestation of this pulmonary embolism is also is dyspnea, pleuritic chest pain, and tachypnea, tachycardia, like that. And for the signs and symptoms that I said, is dyspnea, pleuritic chest pain, cough with blood or not, or we call the hemoptysis, cyanosis, tachypnea, tachycardia, panic, syncope, hypotension, diaphoresis, friction rub, wheezing, rails. We have the elevations. In treatment, we have to elevate the patient's oxygen 8 to 10 liters minutes, and narcotics anticoagulants such as heparin and warfarin. Next is we have the superficial vein disease. This is may occur to women with pre-existing varices, or this is yung mga tawag parang isaw-isaw sa may paa natin. This is nag-enlarge siya, malalaking ugat. The signs and symptoms of this is we have the tenderness, local heat, redness, normal temp or low-grade fever, slight elevation in pulse, and also tender palpable cord. Kasi yung palpable cord dito kasi mga nag-enlarge na siya along the vein. Next is the treatment for that is the application of local heat. Pwede natin i-elevate ang limb ng patient, also analgesic.
Next is I will be discussing the postpartum psychological problems such as the postpartum blues, postpartum major mood, or the postpartum depressions, and also the postpartum psychosis. In postpartum blues, we have the associated with the hormonal changes, which is estrogen, progesterone, and prolactin. It is affects more than the patients that are the primipara, mother to compare mo sa multipara, and it is a 2 to 4 days after birth and lasting to 1 to 14 days. It is emotional hypersensitivity. For the signs and symptoms, we have the overwhelm, unable to cope, fatigue, anxious, irritable, kasi nga pagod at puyat yan kasi the patient, the mother have to do the breastfeeding and also bathing the baby. Also, they're oversensitive to fullness and rapid mood shifts. For postpartum blues treatments, it is para to ensure mom it is a normal adjustment reaction and assistance with infant care, rest, good nutrition, formation, and family support. In postpartum depressions, we have the clinical depressions in 6 months or more. We have the history of depression or bipolar illness, and also the meron na siyang depression during the pregnancy, and also stressful life events and lack of social support. We have the signs and symptoms of postpartum depressions: repetitively depressed state, sad, crying, sleeping, and eating changes. For the treatments of the postpartum depressions, we have the psychotherapy and antidepressants, the serotonin reuptake inhibitors, or tricyclic antidepressants. If it is not effective, we can use the electroconvulsive therapy. In postpartum psychosis, we have the evidence within the first few days after birth. Meron na siyang previous postpartum psychosis and bipolar disorder. Here in signs and symptoms, meron siyang sleep disturbances, depersonalization, o unaware distance from environment, confusions, hallucinations, especially inakala nilang anak na ng demonyo, that's why they can kill their baby, delusions, psychomotor disturbances, agitated, irritable, and bonding difficulties with infant. That's why exercise, it is important that kailangan observant tayo because the attachment of the mother and the baby, it is very important kasi wala silang good bonding. It is a very delikado siya. For the treatments of postpartum psychosis, we have the psychiatric hospitalization, could be psychotherapy and antipsychotics. If it's not effective, pwedeng electroconvulsive therapy. And that's all. Thank you for listening.